Hi there, I'm Jo-Ann Strauss, and I'm super excited to be your host as we launch the new and improved Purity Toiletries range. Now, there's been 2 years of research and development that's gone into this, so you are sure that there are no nasties in what we can now call Purity's purest formulation yet. No parabens, no colorants, no sulfates, no nasties. But we're also going to be learning a lot today, so we've got a wonderful panel of experts who are going to be sharing their input. So take your notes and make sure that you have all of this information at hand. And for those of you who already are part of the Purity app, you'll know that there's a wealth of information at your fingertips. But I'd also like to remind you at this point in time, check out the Purity app, because it's a wonderful way to be part of a community of parents who really care and who really want to share. I'm very excited, of course, to be pregnant with our 4th child. It's an interesting time, of course, I think, for all of the other pregnant moms out there. We all know it's been a total disruption in the world. We're going through a pandemic, and it's a bit of a lonely and an uncertain time in which to be pregnant. But the reassurance that we'll be getting from our panel and from our community, I think one feels then that you're not alone on this journey. And for that, I am very, very grateful. So our first panelist that I'd love to welcome is Dr. Thulja Trikamjee. She's a pediatrician, an allergist, a traveler, a dancer. She's become a registered specialist pediatrician at the age of 30. So she's really got a wealth of knowledge, and she's the second African only with a fully accredited allergy certification. She flies between Cape Town, Johannesburg, and Durban, where she has practices all over the country. And she also travels internationally, where she has positions on 2 international allergy and immunology boards. So Thulja is very accomplished. She has a special interest in newborn care and allergy prevention and pediatric skincare. So I think she'll be able to give us some good insight into the new and improved Purity Toiletries. Thulja, a big warm welcome to you, and thank you for joining us.
Thank you, Jo-Ann. It's such an honor.
We're looking forward to hearing from you. I think we are very interested to find out about the formulations and the impact on newborn skins in particular. So we'll find out more as the session progresses. I'm very, very excited also to welcome somebody who I've gotten to know over the years. I used her blog, of course, You Baby and I, as a big resource when I was having my first baby. So I'm very, very excited to welcome Shaney Vijendranath. She's a very accomplished social media expert, but she's also the mom of 3 young children, so she really knows her stuff. I don't know how she manages to run all her business initiatives. She's an incredible entrepreneur, and she raises happy children. Now, I've met her husband, so I think that also impacts the fact that the children are very happy. They're a wonderful couple. And she's also the brains behind Mom Says and a Forbes Top 30 Under 30 recipient. But not only does she have these incredible accolades, she also makes sure that she pays it forward. She's just raised 50,000 Rand for fellow moms in need with her Back a Mom campaign. Shaney, thank you so much for all your heart that you put into everything that you do. Welcome to you.
Hi, Jo-Ann. Thank you so much for having me. I'm excited to be here.
I'm very excited also to welcome our panelist. We have Jenny Perkel, and she's a clinical psychologist specializing in working with children and their parents in Cape Town in particular. She's also the author of a book for new parents called Babies in Mind, and a children's book called Streets of Jewels. Now, Jenny's message to parents, and Jenny, I must say that this is a message that you send to parents that really resonates with me. She says that sometimes it can be hard to understand your children, and sometimes you might feel like you're getting it all wrong. But as a parent, you are allowed to make mistakes. And there is nothing that babies and young children need more than their parents. Even if you don't feel like it, you are the most important thing in your child's lives. And thank you so much for sharing that, Jenny. I think that really hit home for me. You've already given us a psychology session, a big, big welcome. And thank you for joining us.
Thanks, Jo-Ann. It's lovely to be part of the Purity panel of experts and the Purity community.
Our final panelist, and I'm very, very excited to welcome her, is Lynne Bluff. Now, she's a registered nurse, a midwife, and an internationally certified childbirth educator. Lynne is also the editor and publisher of the Expectant Mother's Guide and the Expectant Mother's Guide Journey app. And she's passionate about giving knowledge to pregnant moms and dads to enable them to have the best possible pregnancy, birth, and parenting exciting experiences. For me, though, I think she's also having her happiest accolade at the moment. She's become a granny for the first time during this COVID pandemic. So she's really been staying abreast of the latest evidence and research about pregnancy and breastfeeding during COVID-19. And she has also used her knowledge to share that with educators, well baby clinic sisters, and lactation consultants. So Lynne, a big welcome to you, and thank you very much for joining us.
Thanks, Jo-Ann. It's just really wonderful to be here and to share some of the expertise.
I always say that time is more valuable than money. You can always get more money, but you can never get more time. And that time that you spend with your children and the time that you spend sharing your knowledge, I think that's just such a wonderful, wonderful way to share the love. So a big thank you to all of you. To me, when I think about Purity and Purity Toiletries, I also know that we are now relaunching the new and improved brand and the new and improved range. I know that there's so much heritage already that's gone into the brand. The trusted expertise was received from Elizabeth Ann's, and that's the brand that I grew up with. Now, even just the scent of that makes me think of babies and childhood. So I'm very excited to experience Purity's purest formulation yet. So it's very good for your baby's skin. We all know that a baby's skin is very delicate, of course, needing maximum protection and nourishment. I wanted to share this with you, actually. This morning, I actually bathed and showered myself using the Purity Special shampoo, because when they said it's not going to let my baby's eyes get hurt, I wanted to test the theory. So Purity, just so you guys know, I did test it. You are 100% right. It did not hurt my eyes at all, so I know my baby's in safe hands. But yes, it's a wonderful brand which we are able to trust as parents. I think it's time to start asking our panelists some questions. We've got them right here. We've got all their expertise. And as moms, new moms, expectant moms, and dads, let's not forget about the dads, we have a wealth of information that we hope to extract. Thulja, my first question is for you. I want to find out firstly, what constitutes healthy skin? And how does one use the most effective products to address and treat the most common skin conditions for babies and newborns in particular?
So I think, Jo-Ann, regarding the skin of babies, the first most important thing that moms need to know is the skin is the largest organ in the body. We often forget that because we consider the skin to just be a covering, and we often think that the heart, the brain, the lungs are really important. But the skin is actually, being the largest organ in the body, it plays a role in so many of the bodily functions. And, you know, with regards to Elizabeth Ann's, it's something that has historical and nostalgic value. We all grew up knowing about the scent, using this on ourselves. We use it on our babies. But what's lovely about this now is there's so much of science and research around what a baby's skin constitutes and what happens in the first few days of life. So, Jo-Ann, the Purity range now has drawn on the expertise and heritage of Elizabeth Ann's and developed new products, which is their purest formulation yet, which is specifically recommended for baby skin.
Then I also wanted to find out from you, Thulja, in terms of washing babies' clothing. We've spoken about their sensitive skin and this clothing that it's directly on your baby's skin. How do we go about washing babies' clothing to ensure that there aren't any irritants for the skin?
Jo-Ann, you know, regarding the clothing on the skin, is that with babies, we tend to wash them much more frequently than we should. And that's why the Purity's range that provides 48-hour moisture is so great. Because you can actually, and pediatricians regularly recommend this, you can go more than 24 hours without giving your baby a bath. The problem with the clothing is that it's extremely difficult. And I know I've seen moms beat themselves up about this all the time. Not all moms can afford to buy specific fabrics and specific clothing that may or may not have been used before or may have the purest fabrics. So if you're going to keep it clean and you're going to keep it nice and germ-free and make sure that you wash it in a range that doesn't have any of the what we call nasty, so those are your chlorines, your parabens and your sulfates, that's the best you can do. Don't beat yourself up about the fact that, you know, there might be something that might irritate baby's skin.
Thulja, thank you very much for the advice. I think it's one of those things that you need to make sure that your baby's clothing is not washed the same way as you would your own. Very relative and relevant points over there. So thank you, Thulja. I also wanted to find out about the importance of mother care before and after birth. How can moms also use the Purity Toiletries range and make sure that they themselves are looked after? What would you suggest?
Yes, there really are some wonderful things that happen during pregnancy, and there are some not so nice things that actually happen. And I think every pregnant mom's nightmare is, am I going to get stretch marks? And oh, what can I do? And every day they go and they check whether it's actually moved, whether it's increased, taking their ruler. And it's an exceptionally stressful thing to actually try and deal with, is this question about stretch marks. And there's some practical things that one can actually do to help keep your body healthy and decrease your chance for stretch marks. And things like keeping your body well hydrated, drink lots of water, massage your skin in the areas that stretch marks are likely to develop in. Your pregnant tummy, your thighs, your breasts, keep that area so that it's supple and it's moisturized with cream, and to increase that elasticity. We need to eat healthily. Healthy fruit, fresh fruit and vegetables really is going to make a difference. And what is so nice to actually do during pregnancy is that you take your stretch mark cream, massage it into your preggy belly, and take those few minutes of time out and totally give your baby this undivided attention while it's growing, and start communicating with us, as well as the benefit that the stretch mark cream is actually going to be doing.
I really appreciate that, Lynn. It's such a wonderful experience. And of course, there are the other side effects of pregnancy. For me, my older children, they love putting the cream onto my belly because they also bond with their baby sister in that time. So very good advice. Use that time to bond and not actually focus on the stretch marks, but actually focus on the bonding. And if you have some battle scars, you have some battle scars. You've done an incredible journey, and it's a miracle. So be it. Lynn, another question for you. I wanted to find out about a condition that I've experienced all the years with all my kids. All moms know about it, nappy rash. What can we do to prevent and also to treat nappy rash effectively?
It's every mom's fear, is my baby going to have a nappy rash? And I think there's some really practical things to do to decrease that problem. And the one is, be diligent. If you know your baby's got a wet nappy or poo nappy, don't put it off. We know it's not the greatest thing to do to change nappies all the time, but be diligent, do it immediately, and that can make a huge difference. And clean the nappy area very nicely. Okay, you can use the Purity's special baby shampoo. Okay, that will cleanse the area nicely. Pat that area dry. Babies have got sensitive skin. We want that area to be nice and dry. And then there's products like the Purity Bum range, where you can actually have a spray bum cream that contains zinc oxide as well, that is going to be soothing and healthy for your baby. Remember as well that actually expose your baby's nappy area to some fresh air. We're so used to wearing masks these days. Isn't it a lovely feeling when you take your mask off and you feel that fresh air against your face? The same thing applies to your baby. When you take that nappy off and the area is nice and clean, okay, make sure that you actually give that baby time to kick around and actually be exposed to the nice fresh air.
Thanks, Lynn. A nice little air bath for the baby on occasion is good. Now, Jenny, I wanted to ask you some of the emotional aspects of skin conditions when it comes to children. I think children, and especially older children, they do react differently when they see that they have skin conditions. And how can one counter that as a parent?
Well, if a child, especially a young child and more especially a baby, if they have any kind of irritation on their skin or anywhere else, if they're uncomfortable, if they're in discomfort, or if they're in pain, or if they've even got prickly skin, or if their skin is inflamed or painful in any way, it's going to mean that they're going to be emotionally uncomfortable in some way as well. So the physical discomfort goes hand in hand with the emotional discomfort, particularly in the very early weeks and months of life. So some children are more sensitive than others to physical discomfort. Some seem to be a little bit more resilient and able to kind of just ignore the discomfort and get along with things. But other children who have certain regulatory disturbances or sensory integration problems actually can't manage the discomfort. Some of them, you probably know, can't wear long, tight sleeves or long, tight pants. And they can't be around sand, or they don't even like the feeling of water on their skin. So it's just so important to bear in mind that what's physical is also mental for children, particularly young children.
Now, that actually brings me to my next question, which I think is quite pertinent to our times now, Jenny. How do we explain COVID-19 to children? How do we explain to them, for example, that our world has changed? And how do we help them adjust emotionally and psychologically in these uncertain times?
It completely depends on the age of the children. So as long as you're keeping the way you talk to your children in a sort of an age-appropriate way, it's help them to get a sense at their age, at their level, what the meaning is of it, in a way that doesn't completely upset them and dysregulate them, but that gives them a sense of, oh, okay, I get this, what's going on. So a good place to start is to find out from the child how they understand it, because that will give you a very good idea as to how to sort of tweak their grasp of it or their perception of it. So if it's a child who's, say, maybe about 4 or 5, you might want to tell them about the germ. You know, there's this, but actually this germ can be quite dangerous for older people, especially like grannies and grandpas type of people, or people who were already very sick. And you see what I'm saying? The way that I'm talking, you're sort of speaking to the child in a way that isn't like this terrible tragedy. This isn't this terrible catastrophe, but that's really just trying to make sense of it in language that they can understand. And then you can help the child to see that they have to play a role in helping to curb the spread. So you can say, so all of us, even you, we have to help by stopping the germ from jumping to person. And the way that we do that is we just keep like an arm or two away from everybody. It's sometimes hard as parents to kind of get your own mind calm enough to sort of manage your children's sort of experience of it. But, you know, you as the parents are kind of like this protective shield, and the parents experience the world through the filter that you offer as the parents. So those children who are very distressed about the virus, which most of the children I've met are not, but those ones that are very distressed about the virus are distressed because their parents are distressed, or they're distressed because their parents have become ill or even died. Having said that, for the most part, this virus does not have a very, very negative impact on most of the people who get infected with it. So I suppose it's very important for parents to keep a sort of a bit of a level head and a balance about the virus, and to recognize that for the most part, people do not really become seriously ill from the virus unless they're older and unless they have the comorbidities that everybody keeps talking about.
Lynne, and this is a question that I think a lot of the pregnant moms watching this are wondering about. With pregnancy, should we be more scared of COVID-19?
You know, Jo-Ann, it's quite amazing, because for most conditions, when you're pregnant, you become more vulnerable and more at risk. And for some reason, and I don't think people actually totally understand why yet, a pregnant mom is not at greater risk during COVID-19. And to me, that is the best news available as far as pregnancy and COVID-19 go. So the pregnancy does not increase their risk of getting the disease in a worse way. It does not give them a greater risk going to ICU, and it does not increase their risk of dying during, from COVID-19. So their risk is as great as anybody who is not pregnant. So one still needs to, I think, really be careful. I think one really needs to take great precautions because we don't want to add any risk. But I think that one can actually take a deep breath and calm down, that actually you are not at any greater risk when you are pregnant.
Thank you so much, Lynne. I think there's a collective sigh of relief for pregnant moms across the nation, because already being pregnant, there are so many other things that you're thinking about. And when you think you're bringing your baby into a safe world, it's so glad to hear that our wombs are protected to a certain extent. So thank you very much for sharing that with us. Thulja, I wanted to find out from you. We've spoken about COVID, and with that comes the constant hand washing and sanitizing. What alternative products can one use when one's child, perhaps the skin reacts badly to sanitizers? And is there something within Purity's new Toiletries range that we can use?
Jo-Ann, with regards to the sanitizers, firstly, the World Health Organization and the CDC has recommended that we should be using 60% alcohol. But as we've discussed, and this is why Purity has come up with this new improved formulation, that sometimes some of the chemicals, and particularly the alcohol in such a high percentage, between 60% and 95%, can be particularly harsh, and especially for children. So the first thing you can do is you obviously want to weigh out the risk-benefit ratio, and you're going to want to sanitize anyway. So if you've used the sanitizer, just ensure that you're doing everything else that you can to make sure that the skin is protected and the skin is moisturized appropriately. So using the Purity washes, which are free of other chemicals. So basically my advice to my patients has been, we have to do the alcohol sanitizers. We have to clean our hands more regularly than usual. But what we can do to counteract that is make sure we protect our hands more by decreasing the load of all the nasty stuff we put onto it. So using a soap for starters that is less harsh on the skin and less harsh on the hands is definitely something you can do. And Purity's new range, especially some of the washes that are soap-free, are great in doing that because you're not going to be removing lots of the oils and the lipids on the top layer of the skin. Once you have sanitized with the alcohol, using a good moisturizer and making sure that you're applying something that doesn't prevent your skin from regenerating, after you've stripped it off the top lipid barrier is also great. And the 48-hour moisture creams are fabulous in doing that.
Another question I have for you is I wanted to find out with newborn babies. I saw that the World Health Organization recommended that children under the age of 4 years old do not have to wear masks. So what do we do with our newborn babies or with our infants? With our infants, do we cover them with a blanket when we go out? Do we just avoid people? Because, everybody loves to cuddle a newborn.
We saw in the first world, and we're now seeing in our country, we've had enough months to see our trends. Children are for some reason protected and are not getting, but also, and this is very important, not spreading the virus as much as adults are spreading the virus. Now, the thing about that, and whenever I tell moms that, only 3% of everyone in the world infected by COVID, in fact, less than 3% are children. The question, and I'm sure you would have the same comment, Jo-Ann, is what if my child is that 3%? How can you guarantee me that if I follow these recommendations, put my child back in a classroom, that my child's not going to be in that 3%? And that's the tricky part. And that's something that each mom needs to individually discuss with their doctor, looking at what the child's individual risk factors is. And it's very different if your child is completely healthy versus if your child has what we call comorbidities, in which case asthma and allergies is one of them. And I'm going to bring this back to the fact that, moisturizing the skin, it's something so simple, which people don't tie together with asthma and with allergies. But research has proven that one of the best things you can do for allergy prevention from day zero of life is ensure that your child's skin is well hydrated and your child's skin is well moisturized, and that you're protecting the skin from anything harsh or anything dangerous. Because we have what we call an allergic march, which generally starts off with allergies in the skin and then can progress to asthma later on in life. Asthma has been labeled a risk factor for COVID. So, just tying back to Purity's range and how even in this time, in the next 6 months, that we are going to be dealing with this pandemic, for new moms, do everything you can from day one. Regarding the masks, the last recommendations I saw from the CDC and the World Health Organization and some of the research, they're looking at children under the age of 2. This doesn't mean that masks are a bad thing. The main reason for these recommendations is the risk of suffocation, the risk of asphyxiation. So if the mask is on the face and if it's covering the nose or the mouth or the airway, your baby is not going to be able to tell you. So just so moms are clear, masks are not a bad thing. It's not a dangerous thing. The only reason for this is because babies' lungs are much smaller and their risk of suffocating from their smaller nostrils and smaller airways is far greater. What I've been doing is I've been telling moms, if you are taking your baby out in a carrier during this pandemic and during this period, just a simple receiver or the baby blanket, which is obviously clean and irritant free. If you're just going to cover just the nose area and the mouth area loosely, nothing that travels to the back of the ears and is going to stick on the face would be a good idea. And just make sure that when you come back into your home, you take that receiver and you wash it into the washing with something that's free of all of the chlorine and one of the products in the range that you could use that's completely safe on babies at that age.
Shaney, you've been quite quiet, but I've got an interesting set of questions that I want to ask you now. I had the chance to register for this app, and I'm extremely excited about this parenting app that Purity has brought out. Can you share a little bit more information since you, I would say, are the most social media savvy person on our panel?
Well, firstly, Jo-Ann, I think when you become a first-time parent, it's so overwhelming. There's so much of information out there, and sometimes it's not the correct information. Like I remember with my firstborn, I freaked out for things that I shouldn't be freaking out on. So having a community is extremely important, for moms to connect with each other, but also for moms to get access to expert advice. And that is one of the things that I love about the Purity app is, as you mentioned before, you have expert advice at your fingertips. And one of the great features for me is, Purity is in partnership with Hello Doctor. So you have access 24/7 to doctors, but also to great articles that could help you through your journey of parenthood. And also another great feature is you can track milestones, which we all know is so important for first-time moms. Like I was one of those parents that freaked out when my daughter didn't crawl at the time that she was supposed to crawl, So just having an app that gives you information like this is so useful and important for moms.
Some of my favorite features, like you mentioned, the milestones, because it is true. It's an interesting thing as a new mom. You want to make sure that your child is developing at the appropriate rate. So you are right.
Yes, definitely. I think, like as we discussed, first-time moms, I was one of those first-time mom that went on Google and just searched for everything. We go on Facebook groups and just get paranoid when someone says, no, this could be something else. And sometimes we stress about the little things. And, we also have that mom guilt where we feel like, oh, did I do something wrong? Or did I use the wrong product, etc. And I think, just having that expert advice for people who know the industry and what's going on. So when you're having that 2 a.m. feeds and, you want to get the right information, Purity app is there for you. That's what I love. It's a brand that's there with you for the first couple years of your parenthood journey, which for me is so crucial and important to make sure that you have the right information. And the best information is by experts, as we know.
Absolutely. And I also love the fact that the app is not just there for moms, it's there for dads too. So both moms and dads, there's great advice for you on the app. I wanted to just go back to the purity range, and we've collected some questions from you, our viewers, and those of you who have used purity in the past and continue to do so. Shaney, also from your community, we had some questions. The one question I received, and I just read now, it says that my baby has dry skin patches. What can I use? What would you recommend to moms in your community?
So having 3 kids, 2 out of the 3 had extremely dry skin. And, I'm also one of those people that have patches everywhere during winter. I absolutely think that moisturizing morning and evening is key for this. And that is why I recommend petroleum jelly. Actually, I put some before I came on, some a bit shiny, but
You've got a nice glow.
yeah, it definitely helps. It's a thin layer, but it brings that protective barrier that you need, especially from wetness, and to protect you, especially now, in the winter months.
Sinead, one of the questions that I've also seen via your community, that they spoke about rashes on babies' faces, which I know is quite common for newborns in the first couple of weeks and months, and I believe actually even within the first year of a baby's life. Now, what would you recommend to use?
When my third child was born, he had a lot of rashes. Like, I had no idea what was going on there. And, I was like, what do I do? Am I using the right product or not? And I think it's important to note that sometimes using too many products can be the problem. So try and minimize, because as a mom, when we see something on our child's face, we want to pick it, or we feel like our baby is uncomfortable, but reality is it might just not be anything. And so sometimes it's good to actually chat to your pediatrician. I would definitely recommend that, to find out what exactly is causing it. And for me, in my journey with my third one, it was actually hormonal. So my pediatrician asked me, what am I eating, what am I drinking, because that could actually affect baby skin via the breast milk.
It is interesting how all of these things are interconnected. Even when the baby is out and the umbilical cord is cut, what you do as a mom still impacts the baby. So it feels like there's always this connection. Lynne, I wanted to find out from you, coming from a midwife and a childbirth educator perspective, one of the questions we had was, I read it, it said my baby was 10 months old. How do I prevent her from getting cradle cap again? What is the best product, for example, to use on her baby's scalp so that it doesn't get dry or flaky? I think, yeah, cradle cap as a mom, it is one of the issues, skincare issues that you do deal with, and moms of newborns know this very well.
Probably all of us. Okay, let's start at looking at what cradle cap is. And cradle cap is the common name for seborrheic dermatitis. And a baby with cradle cap will have scaly or yellow crusty patches on the scalp. And the exact cause of cradle cap isn't really known. But I think one of the contributory factors is that there is build-up of the skin oil or the sebum on the scalp, and we need to get rid of that. So the easiest way to do it is just to take some baby oil, gently massage it into the scalp, and then just take a brush and lightly brush the hair in the scalp, and these scales and crusty patches should actually start lifting. Never try and scratch them off. We can do damage and irritation by that. But actually just let them lift on their own. And then we need to actually wash this baby's hair off and wash this oil off again. Otherwise it can cause more irritation. And just the Purity shampoo or the Purity head to toe wash can work really well. Wash that hair really nicely and then rinse it very well so there's no residue left behind. Okay, and repeat that every day until we see that the cradle cap has actually left and it's finished. And the sooner one actually starts to treat cradle cap, the quicker that it's going to be and more easily that it's actually treated. And so we want that extra moisture for this mom who's actually worrying about her 10-month-old baby. And so the Purity Special shampoo has got 24-hour moisturization. And so once that cradle cap is gone, we can put on, wash the hair with the special shampoo. And then what one can do is that every few days when you wash the hair, that one can alternate between the special shampoo and the head to toe wash. And watch this baby's scalp and see if it does get dry or if it does start to get scaly. And as I say, as soon as that you see that it doesn't look perfectly healthy, just repeat this procedure. And as I say, within a day or two, it should actually have gone. And her baby's already 10 months old. Seborrheic dermatitis, cradle cap usually disappears at about a year. And so don't really stress about it.
Okay, so the answer is moisturize, moisturize, moisturize. And of course, the 48-hour moisturizing with the Purity Toiletries creams, the Aqueous cream, that's really, really important. A big, big thank you to our entire panel of experts for sharing their knowledge and making sure that we understand that parenthood need not be a lonely and a scary and daunting path, but rather a wonderful way to meet a community and enjoy the input from the Purity community. So a big, big thank you. Of course, we're very excited about the new and improved Purity Toiletries range. We've heard that it's free from parabens, free from sulfates, free of colorants, and all the other nasties. Consultant, dermatologist, and pediatrician approved. So lots and lots of research and development went into it. And I think that it really, well, I know that it really is made for the entire family because I have proven that theory. Just a reminder, the Purity app, it is there for everybody to be part of this incredible journey of parenthood. And our expert panel, we have gotten lots of great content from them. So a big thank you. Some of it is also up on the app. So a big, big thank you to them for sharing their knowledge with all of us. We also want to say that this is Purity's purest formulation yet. So it really has been developed with lots of thought and lots of heart in it. And we want to make sure that you understand that this is a journey and a community when you embark on your parenthood journey. I've got quite a couple of weeks to go, not too many. So we've all got our wonderful Purity products, which were delivered. Big thank you for making me part of the community. If you would like to get some more information or just share an experience of the Purity Promise on social media, you can find them both on Facebook and Instagram. And the handle, the username is @Purity Promise, one word, @Purity Promise. If you'd also like to download the Purity app, please visit purityapp.co.za. Thank you for joining us, and thank you for sharing your time and for being part of the community. All the best to the moms, the dads, all the families out there in these interesting times we find ourselves in. Know that what you do is enough and that being a parent is the greatest, greatest gift.